Hello, welcome to Schools in COVID, what Stanislaus students and parents need to know. My name is Emily Isaacman. I cover education for the Modesto Bee's Economic Mobility Lab. The lab is a team of 3 reporters and 1 editor. My colleagues report on underserved neighborhoods and economic development. This is the 3rd school year affected by COVID-19. For the first time in a year and a half, almost all children in Stanislaus County are back in school buildings learning in person 5 days a week. But returning to school has brought a host of other issues. Hundreds of students and staff have gotten sick as the Delta variant spread through our community. Schools and families have had to navigate new quarantine guidelines, address academic losses from distance learning, and support students and staff through mental health challenges. And just last week, Governor Gavin Newsom announced eligible school children will be required to get the COVID-19 vaccine when it's fully approved by the FDA. We hope today's forum will provide some insight into how students, teachers, doctors, and administrators are approaching these topics and more. I'm joined today by 4 panelists: Sarah Noguchi, Superintendent of Modesto City Schools; Rana Benanka, a senior at Modesto High School and Student School Board Representative; Meredith Pimentel, a 3rd grade teacher and president of Turlock Teachers Association; and Dr. Chrisanna Mink, a pediatrician and former health reporter at the Bee. Tonight we'll be asking our panelists questions submitted by audience members. In some cases, we combined similar questions and added some of our own. Throughout this conversation, you can leave questions for the panelists in the comments section, and we'll try to get to as many as we can. Our first topic tonight is about COVID-19 prevention measures, including masks, testing, and vaccines. Just this morning, hundreds of people protested the new state vaccine mandate for students outside the County Office of Education. Superintendent Noguchi, how do you and your district respond to protests like this?
Well, certainly we welcome individuals to have their voice and their opinions in the process. Regarding students at protests, that's not something that we encourage to have students leave the classroom. At this point, we need folks in the classroom. So in looking at that, while we encourage freedom of speech and getting your voices heard, we really need students in the class.
Dr. Mink, what do you say to people who are protesting vaccine mandates and refusing to get the vaccine for COVID-19?
In the clinic, when I'm working or out in the public, I always ask first, what are your concerns about getting any immunization? Protesting COVID vaccines is new only because it's COVID. Protesting vaccines has been around for a long time. I have to say, a little concern that people are protesting about the governor having a mandate for the COVID vaccine. And let me share with you why. And I heard a concern that, they haven't even done dose ranging and they don't even know what's going to happen. And that's actually not the facts. And I used to be a reviewer for the FDA, for the Office of Vaccines, so I know how the process works. The COVID vaccine, unlike any vaccine, is tested first in adults. Okay, it's been through that. It has full approval for anybody that's adult age group, right? And then they did tests in kids from 12 to 17, and it's been approved for those kids. What's happened now, phase 1, phase 2, phase 3, those are the early studies, the middle studies, and then the big efficacy safety studies have happened in 5 to 12-year-olds. The dose of vaccines, I guess some people in the county aren't yet aware that the dose has been tested. It's 10 micrograms of the antigen as opposed to the adult that's 30 micrograms of antigen. And that was tested before they did the big studies with it. The kids get a great antibody response, and they have sort of the same safety reactions, adverse pain, local swelling, some fever, as healthy adults 16 to 25. And that makes sense that you need a little bit lower dose. They have a healthy young immune system. The dose that's been tested, it looks good. And those early data have been sent to the FDA for review. And what would happen first would be emergency use authorization, just like we had for the adults. and then it would come to full approval. And that's likely not to happen until next spring or fall. So I understand people's frustrations and wish to express their opinion, but we have a lot of data and we also still have more time. Not to mention that millions of doses have been administered already. And mandating vaccines for schools is not new. You know very well, everyone has their yellow card, and that you had to prove vaccines for you could enroll in public schools in California. And actually, this went to the Supreme Court back in 1905 with the smallpox vaccine. And the Supreme Court says, yes, we respect individual rights, but this is a matter of public health. And it is legal to mandate vaccinations for public schools.
Mm-hmm. Meredith, you're in classrooms every day. What does mask wearing look like? How do people feel about vaccines? What are the biggest challenges with implementing some of the prevention measures at your school?
With masks, students, for the most part, are wearing them correctly. Occasionally, a few times a day, you have to remind students to put them over their nose. That seems, with third graders, that seems to be the biggest challenge. Just in regards keeping them, I have my students sitting at tables, so I have barricades that are around them to keep them a little bit safer. I know students are in desks that are close together now, so that's not a concern. In regards to the vaccine, people have very strong opinions on both sides of the issue. So that's what I'm hearing a lot right now. I have students share with me that my mom doesn't want me to get the vaccine, or some students share that they're getting the vaccine as soon as they can. So that's what we're hearing.
And Rana, what about you? You're also in classrooms every day, surrounded by other students. What are you hearing about students' general attitudes towards mask wearing and vaccines and prevention measures like that?
Yeah, so overwhelmingly, I've actually seen students wearing their masks and following the CDC guidelines. Occasionally, of course, there are going to be a few exceptions, some students that have it below their noses or that use it as a chin strap. But in general, students are wearing their masks and they don't really seem to mind the masks. I find it quite ironic that I've seen more parents upset about the masks on behalf of their children than I have seen students themselves be upset about the masks. And I think that just really speaks to the situation as a whole and the reason why we need to listen to students directly, because, in general, students are fine with this. And when it comes to weighing this and analyzing the situation with cost-benefit analysis, if you were to give the students a choice of either, go to school and wear a mask or stay home with distance learning and not have to wear a mask, what I'm sensing is that most kids would much rather go to school in person and wear a mask. But that's just the general attitude I've seen in my school and just in schools around the district.
For sure.
Yeah. Emily, could I add to that? Actually, Rana, there are data to support what you're seeing. They've done some, different studies, not just in the US, truly globally. The students are at this point so happy to be back in school, and they don't care about masks as much as some of the parents seem to care about masks. And actually, the one age group, interestingly, is like the pre-adolescents say they like to complain about it, but they still are happy to be back in school and wear the masks. Yeah.
Yeah, thanks for adding that. And Superintendent Noguchi, can you tell us about the district's testing programs and why that matters to keeping students in school and keeping students safe?
So it took a little bit to gear up for the testing protocols. So currently for Modesto City schools, we have testing available at all of our school sites, from elementary, junior high, and high school. The importance of testing is really just that, is to be able to see when the disease is in fact detected, so we can move those students or staff home to quarantine. So The benefit of having testing at the school site is twofold. One, our employees are required to either show vaccination or be tested starting October 15th. So it really is going to be a service to our employees to be able to have quick and easy ways of getting testing. Secondly, students that are on modified quarantine, those students that are still going to school without showing any symptoms, they have the opportunity to test at school initially, and then every 3 days, I believe. I think it's twice in a 7-day period. I don't know exactly the dates on that, but it really provides an opportunity for students to be in school, which is exactly where we need them to be.
And Dr. Mink, can you talk about what we know about transmission at this point? Where is the spread of the virus primarily occurring, and how effective are preventative measures proving?
Generally speaking, there seems to be more transmission in the community than specifically in classrooms. Although I think the last week for data in Stanislaus County, there were 7 outbreaks associated with schools because on the county public health dashboard, they track the industrial related outbreaks. So it's not 0 in an academic setting, but the community seems to be much more of a concern for how well, especially this Delta variant, has been able to get through the community. The good news is, and even nationwide, but in California, we're on the downtrend. And the very good news is California is one of only 2 states in the country that is not high transmission. We're considered just below that at substantial transmission. Vaccinations matter. Not talking if you're pro or con, just saying data. Immunization matters. And the states and the county that have higher vaccination rate have lower rates of community transmission. Altogether, the mitigation efforts, masking, social distancing, or physically distancing, however you like to say it, optimal ventilation, and as many of the eligible being immunized makes a difference for keeping kids in school. And early on this spring, the CDC specifically said schools should be the first to open and the last to close. And those mitigation efforts hopefully allow us to keep our kids in school.
Moving on now to exposures and school quarantines, which Superintendent Noguchi mentioned a little bit. It seems like a complex process, especially at the junior highs and the high schools where students move from class to class to try to figure out who needs to quarantine and whether they'll stay home or in a modified quarantine at school. So can you describe your contact tracing process and an overview of how you determine who needs to quarantine and in what way at this point?
I can tell you part of it. I'm not an expert in that because I have contact tracing teams at each of the individual school sites, and it is very intricate depending upon a myriad of different factors. So if you could go to our website and it's detailed there because at each of the schools we have a contact tracing team. But what I can say globally, and I can talk about the junior high and the high school, each school has a contact tracing team. When we become aware that a student has tested positive, we pull the schedule of that student. We then look at all the students that sat around that student within 6 feet. That's the contact tracing. They then are initially quarantined, and then contact tracer call them and identify and ask them if they have any symptoms. If they do not have any symptoms, then they are eligible, I believe, to be able to come back to school, but with testing protocols in place. Again, there's a lot more nuances in that. There's a lot of expertise that's involved, and also partnering with the county public health. So I was able to answer that for you.
And if students do need to quarantine at home, do you know how many days of school they tend to miss on average?
Well, it depends. If you initially quarantine until you have a conversation with that student. If I'm a student and I was in a class and I was next to someone that had COVID, I need to go home and wait till a nurse calls me, which is the contact tracing team, That nurse asks me, do I have any symptoms? If I don't have any symptoms, then I'm able to go back to school with testing. If my parent or myself do not want to do testing, then we need to remain at home for a 10-day period. So it really depends upon the time it takes for the contact tracer to contact that student. At the beginning of the school year, it was much longer because we didn't have the literally 30 contact tracers that we have hired out into the schools. So it's a much shorter time period now because we figured out how to do this work.
Mm. Do you know about how long it tends to take now for the contact tracers to contact exposed students?
I do not.
Meredith, how do quarantines affect teachers, classrooms, and instruction? And how are teachers instructing students who are homesick or in quarantine?
It affects us. It affects the classroom teachers because when students are absent, they're missing instruction that's being given to students that are in person. So when earlier this year, I had about 7 to 9 students absent for almost at least a week to a week and a half, and that was very difficult. I was teaching what I needed to, but kids that were home were missing some instruction. They are given, the elementary students, TK through 6, are given packets put together by the district, as well as teachers putting together math that they are currently working on, or other subjects that they're working on. So they're getting those packets. 7th through 12th graders are being able to tune in on Zoom. It's a one-way instruction, so they're able to watch and listen to the instruction for their classes, and but they cannot interact. And teachers in high school and junior high, and as well as some in elementary, are posting assignments on Google Classroom, so students will not fall behind.
And this is an audience question from Katrina in Modesto. She wants to know, with students being home quarantined for 10 days or more, they are missing direct instruction. I know students can pick up work at school and older students can access work on Schoology, but that doesn't help with important concepts and information given by being in the classroom with direct instruction. What are schools doing to help students in this situation so they don't get further behind or frustrated? Meredith, I know you talked to that a little bit, but do you or Superintendent Noguchi want to answer that one?
I certainly could share what Modesto City Schools is doing. It is different in Turlock, and what you'll find with each of the districts in Stanislaus County, it's different. It's different procedures and memorandums of understanding, if you will, between the Teachers Association and administration. We recently worked with our Teachers Association, Modesto Teachers Association, to draft an MOU that is actually going to be going out for ratification on Friday with our teachers union. And what we did with ours is we aligned to the laws from the state. The legislature really dictated how we were going to be doing distance learning this year. It can't be the way it was last year. And so for our students moving forward and teachers moving forward, they will be checking in grades K through 8 on a daily basis, and with some synchronous learning at different grade levels. Again, it's aligned to what the state has outlined, and the same thing for high schools. Many of our high schools have put their lessons on Schoology. We now are going to have all of our lessons on Schoology. It's now the agreement, assuming that it is in fact ratified. And the same thing for elementary. Elementary students are going to be able to access all of their information online, much of the same platforms that they used last year. Prior to this, many of them were given packets, and that really, we didn't believe that was really in the best interest of the students, because we knew that we could provide them a much richer learning environment by engaging with them through Schoology. So there are going to be some changes moving forward. We do have a day scheduled. Monday, it was already pre-scheduled for a pre-service day. Basically, it's a day that all kids stay home and teachers and staff are provided professional development. It was already in the calendar, and we're very lucky to actually capitalize on that on Monday and train some teachers, some of our new teachers, and reacquaint some of our teachers that did this last year. And so we'll spend a day working with our teachers in getting that up and running so we can move forward.
Yeah, it sounds like that timing works out well. Do you know when, after that training, students can start to see the new agreement take effect? And
yes, so Monday is the training. Wednesday is a collaboration day. Collaboration day is where teachers at grade levels or subject areas get together and develop lessons and develop curriculum, instruction, timelines, and such. So they'll work together. They're going to get the training on Monday. They're going to work together on Wednesday. And then the following Monday, all teachers will be required to have that up and running in Schoology with lessons. Again, it's a learning experience. It would be great to just turn on a light switch and say, we've got high quality distance learning instruction. It takes different teachers, different time frames, but we're looking to put that into play that following Monday, which hopefully that week teachers have the time that they need to be able to get prepared for that.
yeah. And Rana, are you seeing the potential of getting COVID or being sent home to quarantine affecting students' perspective or actions on campus in any way?
Well, I think that a lot of students already have the vaccine. I think that those students feel very comfortable. I definitely think that students don't want to miss out on time in the classroom, and you know, obviously, most students would want to avoid getting COVID. But in terms of the way that teachers have been connecting with students, I think that because we had that year of distance learning, you know, both teachers and students have become very acclimated with using technology to communicate with each other. So as Dr. Noguchi had mentioned, a lot of teachers in high schools are using Schoology to connect with their students. And so, you know, if that scenario does happen to a student, there is a way to remedy that. And I think, you know, students still are able to complete their work and to get the assignments and to get at least some of that instruction in, even though it might not be in person.
Mm-hmm.
I'd like to add.
Do you sense that students are genuinely trying to avoid, you know, COVID?
Sorry, Ron. I thought you were done. There's something that is a missing piece to what I've shared and what Rana has shared, and that is, while you can put content in Schoology, which is a learning platform, it really we really need parents' help and students' help in continuing to engage, because we know it's not as engaging sitting on your couch or in the kitchen table. And so while yes, we can provide the tools and we can provide the structure, it really is the human element. And so we really work with our parents, we work with our students. We have re-engagement teams as far as getting those kids that really have just are unmotivated. That's the next piece of work that we need to work on, is how do we continue to engage kids when we know it's not at an environment that is optimal. But we certainly ask for and look for support from our parents and our community and our guardians.
Mm-hmm. We got an audience question from someone watching now. Jessica wants to know, why are we only testing unvaccinated? Vaccinated can still be carriers. Superintendent Noguchi, do you want to address that one with?
You know, I'm actually going to see if the doctor has an answer to this one. Again, I'm not in the weeds on this because I have teams at school sites that make these decisions. So I'm not saying that they're not tested. I would think if they were around an exposed student that they would be tested in that time, 2 times in that time period. But again, I don't know that for sure.
The CDC protocol does include testing of vaccinated or unvaccinated, because vaccinated people can still transmit the coronavirus. They are less likely to get infected, so less likely to be the ones transmitting it if they're vaccinated, but they still can. So yeah, I'm assuming you're following, and I know your staff does an amazing job, so I assume you're following the CDC guidelines. So yes, the vaccinated are also tested. The rules for Quarantine are a little different if you're vaccinated, though, which is another real perk in that if they are vaccinated without symptoms, they can be masked and still have the ability to attend things. So,
Attend school.
Yeah, I think maybe that's what the person from Facebook was referring to. And in that case, it's like you said, because of the quarantine guidelines, right?
yeah.
Yeah. And then moving on from issues directly related to the pandemic and prevention measures into some questions about mental health issues and the adjustment back to school campuses. For Superintendent Noguchi, we got an audience question from Maria in Modesto asking, in what ways do present and future COVID protocols consider the mental health impact on our kids? Mental health of students suffered tremendously during distance learning, and there weren't enough resources for parents and students. Do you want to talk about some of the ways that you are supporting students with their mental health and providing resources?
Certainly. So I can say that we started out the school year really focused. We started out with teacher training around really focusing on the mental health needs of teachers and students and parents, and really approaching it through an empathetic eye. One, relationship building, trying to meet kids where they're at, understanding what they've gone through. And something I can share that we just recently did a survey of 1,200 respondents, and parents did mention in there that they have really appreciated teachers' approaching the work this year with an empathetic stance. As far as the social emotional supports, we have greatly increased our social emotional resources. So we have student assistance specialists at all of our schools. We have curriculum in the elementary level. It's second step. It's a curriculum that they use in the classroom. But more importantly, it's really working with our teachers to identify those mental health needs of our students as they come up on a daily basis, and then working with our mental health staff, not only student assistance specialists, but our counselors and our psychologists. And we have a great system of support with the county. There are a lot of supports out there. Is there more work to do? I believe there is. And I think Rana could really add to this. She spoke to some degree about a month and a half ago, and that is getting the communication out. So how can we support parents in understanding where to go when they see that their students need support? How can we better communicate out the resources and supports? That's a piece that I know that we need to continue to work on, and we will. Lastly, we have done extensive training with parents as well. Up to this point, which is we're the very first part of October, we've already had 3,000 parents engaged in trainings. Some of that is mental health training. Some of it is advocating for your child. There's a number of different trainings, but our parents are also a huge resource for supporting our students with mental health, and again, getting that information out to parents as far as what resources are available to them.
Rana, do you want to talk about what Superintendent Noguchi referenced, just what you're doing and what you're hearing from other students on campus, and how the adjustment back to school has been going?
Yeah, I can definitely say that this pandemic has had the greatest impact on our collective mental health as students out of anything that's ever happened in the history of our lives. And so I think it's taken a toll on many students, and that toll still exists to this day, even though we're back in person. These students are now affected by these issues. And so something that we're really focusing on our district is listening to students and hearing what they would like improved. And that's something I think our district does very well. For example, at our last inter-high student council meeting, I asked students how they'd like to see the third wave of the ESSER funds being spent, which focus a bit more on socio-emotional support. I presented those opinions, viewpoints to the board, and the board and the district is really taking the time to consider student voice and to consider what students say that they would like implemented. And that's really evident in all of the investments that we've made in mental health. Just from my experience of being a high school student at Modesto High School, I see these, a lot more communication, as Dr. Noguchi mentioned, which is something that I really wanted to emphasize because I think there are a lot of resources. So that the problem sometimes is just as simple as, there's not enough communication. And so recently I've seen a lot of suicide awareness posters all around school with resources of how to get help. And that's just one example. But all in all, I really appreciate the fact that we're listening to student voice, because as I said before, really when making these decisions and making policies for students, student voice and student perspectives is probably the most important perspective to consider before finalizing any decision.
Meredith, you work with you teach younger students. What are you seeing in the classroom this year? How has their mental health been affected, and how are they doing with this transition back to the classrooms?
Students are very excited to be back in the classroom. I can tell you that. They're excited to be around their friends and be able to play. We are working hard to teach them the rules again. Some kids, it's a lot harder this year on teachers that I've been finding and talking to, getting them to follow the expectations and the norms in the classrooms. We seem to have lost a lot of ground when it came to that being on quarantine for as long as we were. But the social and emotional, Turlock has done very well spending the ESSER funds as you referred to. We have a school counselor on every elementary site, as well as every middle school and high school. Now, I can speak for the one on my site. She is incredible. She reaches out to students. She is checking in with teachers to see how we're doing. She's reaching out and checking in with students. Working with them. We also have something called the CARE program. So when we refer students, they'll either work with the school counselor, or they'll work with somebody that can work with them a little bit more intensely on issues, because we are seeing that this pandemic has really affected kids in different ways. Some kids are fine. Some kids have anxiety. Some kids are extremely scared to be at school. So we're doing the best we can in Turlock to identify those students. Teachers are doing social emotional activities for about 15 minutes a day, checking in with kids, seeing how they're doing. We also use a program called Toolbox, where we teach kids to, somebody says something you don't like, throw it in the garbage can, get rid of it. And just different strategies that help them socially and emotionally as well. So we have a pretty good program going on in Turlock.
And as a follow-up, how are you seeing students, now that we're a bit into the school year, how are they responding to that 15 minutes of social and emotional learning time and the additional strategies that Turlock is using this year?
I see it as a benefit. It is helping students. Some students who were leery at first to share how they were doing, how they feel, are starting to open up more. Students are using those coping strategies that we're trying to teach them when they feel different ways, when they feel sad, when they feel stressed, when they're, because a lot of kids are really stressed right now too because of the learning gap that happened. So we're trying to just teach these strategies for them, and it is helping. We are seeing improvements in students being able to cope and deal with things. So it is beneficial.
Can I add too? From the
I was just going to ask you.
Thank you. Perspective. Obviously, I haven't been in Stanislaus for a few months, but even when I was there last spring, all of the districts with whom I spoke were putting putting things in place. First, addressing the mental health of staff and teachers and personnel so that they would be prepared for the students when they came back. And then so many programs getting in place for the students. And I really appreciate the comments about communication, but I'm going to add to it that all of us can work on removing the stigma to ask for help. And there's like an old book that's I'm okay, you're okay, or something. I can't remember the title exactly. What we've been saying is we're all affected. I'm not okay and you're not okay, but that's okay. So that we can, as Dr. Noguchi said, meet everyone where they are at that day, because there are some days that we're fine and some days that we're not, and it's the same for kids. And the other thing we can do is model by saying, putting words to our emotions and that we are asking for help too. And again, that helps remove the stigma that, you know what, it's not okay. I need some help. This is a crazy day. And for kids to know that it's okay to ask for help is really important.
Looking forward now, this is a question for anyone to answer. Anyone can jump in. What silver linings are you taking away from the pandemic's effect on education, and what changes that happened during or after the pandemic by necessity do you want to see continued? Does anyone want to jump in on that one?
I can jump in on that one. We've learned that schools are now no longer just for academics. We are finding that students need schools for the interaction. They need it for the communication. They need to be around their peers. So we're seeing that schools are highly important for students to be at and in person. That's one of the benefits that not benefits, but silver linings I'm seeing is that there's just more of a importance put on schools now than ever.
I can chime in. I think there are many silver linings. And it's not what we'd want to go through, certainly, but there's a lot that we've learned from. For one, just as an organization, we have a better capacity to change. We have had so much change in such a small amount of time that just dealing with that and working through that, either, through management and leadership. So I see that as a great silver lining. Additionally, technology has taken off. We have technology in the hands of all of our parents. We have more engagement with parents than we have ever had. More engagement than I ever would have imagined. We had tens of thousands of parents engaged in some form of workshops through, the web portals last year. This year alone, like as I mentioned earlier, 3,000. I see that as a continuation moving forward. I think also a deeper understanding of public health. I think we took public health for granted, right? We now know how to not get sick in flu season. Now, what we will move forward, I'm not sure, but in the health and safety protocols at our school sites, I know that we're going to be in a much better place with our HVAC systems, state of the art now, and many of our protocols. I believe will stay in place just because it's healthy. It's a healthy thing to do. But I think the greatest benefit is going to be the outcome from the myriad of programs that we've been able to put into place, and we've only been able to put them into place because of the COVID dollars that we've received. And the programs had to all align to either academic need, social emotional need, or mental health needs. And so we've now put in a number of different programs. We now are monitoring those programs. We will continue the programs that we see are working, and then we will discontinue those that didn't have a large impact. So I'm very excited for 3 years from now when we can look back in the rearview mirror, because I think Modesto City Schools and many schools are going to be much better equipped to deal with the social, emotional, and academic needs of our students.
Rana, what do you see as any silver linings or lessons learned that should be continued from the pandemic?
Yeah, I think that there were many silver linings from this pandemic, as tough and difficult as it was for so many people. As we were talking about before, I think that the increased investment on mental health and making sure that mental health services are accessible to students, that's going to carry on for years. And I'm so glad to see that work is being done because it was highlighted through this pandemic, because it's something that affects so many students. Something else that I think was a great silver lining is our increased emphasis on addressing the inequities in our school district. These inequities were, of course, amplified by the pandemic, by distance learning, not just in our district, but all across the state and even the nation. And I'm really, really proud of the work that our district has done to address them. I think we're really being proactive. For example, we have an equity committee, which is dedicated to analyzing these issues, and it's comprised of students, parents, staff. As Dr. Not only are there more students, but there are more parent engagement, but there's also more student engagement. There's more student voice in the process, and more students are energized and really see the importance of giving their input to the district, which of course is great. And then also, I think something that we're doing great in our district is taking a multi-pronged approach to addressing our achievement gaps. I think that having a multi-pronged approach is extremely important because if the achievement gap could have been solved with just one policy, I guarantee it would have already been done. And so I'm really glad to see that we're working, in terms of we're improving our professional development and our teacher trainings. We're analyzing our grading policies and we're analyzing our new course offerings, and just all of those ways of really evaluating how we can close these achievement gaps. I think those are really, really important.
Meredith, did you have something
from this
else to
pandemic?
add?
Oh, was she done? I'm sorry. Were you done?
Yeah.
Okay. Another silver lining in this is that we have found that teachers and school staff, like all school staff that have been having to juggle this pandemic, we are more resilient. We have found that we are very resilient and we can get through this. I know teachers all over the state, the country, we're working harder than we ever have before. And we're doing it to make sure our students, we can close the achievement gap. We can be there for our students, socially and emotionally. It just shows too that school staff and all, teachers, administrators, paras, everybody, we want to be there for the kids, and we're doing everything we can to make sure that we're keeping them safe and giving them consistent learning in the classrooms. And I think that's part of the silver lining, is just the resiliency that we're seeing among staff and students. I mean, students too, they need to be resilient in this. We're seeing students try harder than they ever have before. I know in Turlock, to piggyback when you were talking about the achievement gaps at every school site in Turlock, we have an ELA, an early literacy coach. We have ELA and math coaches that are helping bridge the gaps in achievement with our students. So we're working hard right now, harder than we ever have, to make sure our students are getting the education that they need.
And continuing on something that both of you mentioned, the achievement gap and addressing student academic losses and gaps, Superintendent Noguchi, can you talk about what your district is doing and what you're planning for over the next few years, as I think you said before, to help students catch up academically and fill in those gaps?
It's really just looking at extending the learning time. So, beginning last year, and again, we've got funding for 3 years to do this, but it's expanding before and after school programming. It's expanding intersession, which is that time for the spring break and the winter break, expanding summer schools, expanding the programs after school to include not just tutoring, but narrowing in and identifying specific gaps to be able to help our students. In addition, it's allowing students to take additional coursework online, because now we have online, and so we can capitalize on time home. So it really is looking at providing those opportunities for students, but also through the lens of the capacity we have of our teachers, because our teachers and staff are also exhausted. So while, yes, we would love to have 100% of our kids, go to school during winter break and go and continue on during spring break and continue on during the summer, folks need a break. And that's important for mental health as well. And so we have many programs that are set for that. Additionally, it's really looking at, what do kids really need to know? So doing the diagnostic testing for math and English on the front end, identifying those skill sets that they need for that following year from last year, and then pairing those together with this year's analysis. So we're not teaching everything, we're teaching the essentials and the essential core of what they need to be successful moving forward.
Rana, as a student, what do you think that students need to help catch up and get where they need to be?
Well, I definitely agree with Dr. Noguchi. I think that one of the great ways that we can remedy the learning loss is through our summer programs. And I remember at the last meeting, or it was either the last meeting or the one before that, we got a presentation on how the summer programs went in this past summer. And I found it astounding to figure out that over 15 or almost 15,000 total credits were earned for high schoolers during those summer programs, which just speaks to just the amazing successes of these programs. And as Dr. Noguchi stated, we have the funds to continue this in the coming years. And I think that that's one great way that we can remedy learning loss. But in the classroom, I think is that our teachers are aware of the fact that we've endured this learning loss, and they're very empathetic, and if they need to take a little bit of class time to explain some concepts that we might have not really picked up on as much, they'll take that time. And so I think that empathy, as we talked about before, is also really important.
We have an audience question from Christine in Turlock, who wants to know, what are the most important steps that students and parents can take to contribute to the success of our school programs and this year's academic goals? Maybe Superintendent Noguchi, do you want to answer that one, or whoever?
Well, parents are the first educator of that child. They are the most important person in that child's world and in their educational experience. It's working with the teachers and the programs, supporting the teachers in the content that is being offered, supporting their children in the questions that they have, but also understanding that, I don't subscribe to this learning loss. There wasn't a loss, it wasn't learned. You can't lose something you didn't have. And just this notion for our kids not to feel like they're behind and something's wrong and they're not going to be prepared, and all that anxiety. I've seen more anxiety in kids this year and last year than I have in the past, but I think it's also the way that the adults are framing it. They're going to be okay. All third graders, all seniors, all went through the same experiences, right? And so I think it's partnering with the schools, it's understanding the children, and recognizing it really is going to be okay. We are all going to get through this together, and your child is going to be successful.
We have another audience question. This one from Kate, submitted through Facebook, wants to know, what disciplinary actions happen for teachers and staff who do not follow safety practices in their classrooms due to their own beliefs and ideas?
I can take that one. That's pretty broad. If it is safety practices such as mask wearing, then they wouldn't be allowed to be in the classroom. We haven't found that. We haven't disciplined anyone for not wearing their masks. If it is the requirement of the vaccine, it's actually not required. It's either vaccine or testing. So there's an alternative there, and we will follow up with the staff that don't have the vaccination in their testing, because they need to test once or twice a week. At this point, we haven't had any, that I know of, we haven't had any disciplinary actions against teachers or staff in the safety protocols.
In Turlock, Meredith, are you familiar with the disciplinary actions for teachers and staff for your district?
What usually happens is there's a warning first if they are not following a protocol, and if that continues, then they can have something written and put in their file. But I have not seen anything happen past that due to these not following safety protocols and practices in our district. So those are just some things that can happen. I haven't seen it happen yet, but that's what would happen right now if. It's just usually conversations, warnings, making sure that people are following the protocol. And then if they need to go further, then they meet with the principal again.
Mm-hmm. Another audience question from Liz in Denair wants to know, based on the current trend and cases, as well as us entering flu season, do you foresee schools needing to shut down? Maybe Dr. Mink and Superintendent Noguchi, if you both want to answer this one.
I can start.
Great.
I have no ability to predict what's going to happen. If we had controlled, then we wouldn't have had this third surge with the Delta variant. So both SARS COVID virus and the influenza virus have great ability to mutate, and that's when they can evade the immune system, even if you've had them before. Thus, annual immunizations against influenza. Fortunately, last year with all the COVID mitigations, we didn't see a lot of flu, right? And ideally, as Dr. Noguchi already mentioned, maybe that'll happen again. Maybe, because we're all absolutely washing our hands and staying home when we're sick, which is a great lesson to learn, to stay home when you're sick. We may not see a lot of flu again. In the Southern Hemisphere, we watched them to see how they did because it was their winter. They didn't have a bad flu season. However, if flu and COVID were to hit us at the same time, yes, it would close schools. It might also paralyze hospitals. Just like teachers and students, medical personnel are exhausted in dealing with the pandemic for the last 20 months. And we're running low on resources, truthfully. So maintain the mitigations as best you can to keep kids in school and to keep our health care system upright. It really does matter for so many reasons. And there's some concern. I've heard people, and I think even one of our commenters said, kids don't die from COVID. Why are you so worried? 6 million kids in the U.S. have had COVID. We have had deaths. They have a lower rate of deaths than adults. But any child that dies from a disease that you could potentially prevent is too many. And 6 million kids who are sick and could spread and could miss their education it's too many. I know everyone here in education, everyone in pediatrics, their first priority is to try and keep kids healthy and learning and thriving to be the best adult that they could possibly be.
Superintendent Noguchi, can you talk about how the district is talking about or considering or thinking about the possibility of a school shutdown, if that even is a possibility?
No, I'm not public health. Public health makes those calls. I don't anticipate that we'll close schools, because if we could open schools in what I thought was the fourth surge, I'm hearing Dr. Ming say the third surge. I don't know, whatever surge it was. If we could open schools and stay open, then I don't see us closing down. But again, I'm not public health. And so no, we're not planning to close down. If we close down, we're going to be in a much better space than we were last time, because last time we closed down and we had our entire elementary district that didn't even have a computer. Right now, we have access to. Everyone's, we're training, and so we're in a much better position. So
I think we have time for one more question. So we have a question from Facebook asking, are individual districts allowed to choose not to enact the governor's recent vaccine mandate? I don't know who wants.
No.
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 And again, the mandate it is not until the vaccines have been fully reviewed and approved by the FDA. So next week, the 5 to 11-year-old data may be reviewed by the expert panel for the FDA for emergency use authorization. So it's not going to happen soon. And there's so many other bridges to cross and lessons and information that it's not time to worry about that.
Yeah, I'd like to add to Dr. Mink's comment. On the governor's website, there actually is a document. It's the first document when you first go to it. It says, based on current information, we have to do that with everything now because given today, because tomorrow it might change, but based on current information, the requirement is expected to apply to 7 to 12th graders in July. So I really think it's important for parents to know that we have many months before it's actually going to be required. And a lot can happen between these months. So we're not in an urgent moment. It's not a decision you have to make now. It's not even a decision you're going to have to make by New Year's Eve. We have time. Now, ultimately, once that decision is made, then we have to abide by we abide by CDPH, which is California Department of Public Health, which is governed by the governor, and that's not our call. And so we have some time.
Well, we're just about approaching the 1 hour mark. This has been an excellent conversation, and I want to thank all of our panelists for joining us this evening, and thank you to everyone tuning in too. The Economic Mobility Lab relies on your support to keep doing events and reporting like this. To learn about how to donate, visit modb.com/news/Economic Mobility Lab. Also, we'd love to connect with you on social media. Our DMs are always open. You can like our Economic Mobility Lab Facebook page and follow the Modesto Bee @ModB. My own Twitter is @Emily Isaacman. I'd love to hear from you. I want to once again give a big thank you to all of our panelists for joining us tonight. Thanks, everyone.